Hello, I am Dr. Vijay Ramachandran, Consultant Surgical Gastroenterologist at Naseem and Rabeeh Medical Center, Searing Road, Doha, Qatar. I will be visiting once a month at this center for consultation and will be available for consultation for patients who are having disorders pertaining to gastrointestinal tract. The topic which has been chosen for today is colorectal cancer. This topic has been chosen because the entire month of March 2018 has been declared as a colorectal awareness month. During this course of this 10-minute talk, I'll try to address the disease of colorectal cancer, try to answer certain queries which are pertaining to colorectal cancer, and clarify certain misconceptions or doubts which are in the minds of the viewers. First of all, what is colorectal cancer? During this talk, I would like to tell you that we are basically going to talk or discuss about cancer which is pertaining to the large intestine. As you are all aware of, the human body is composed of both the small as well as the large intestine, out of which cancers commonly affect the large intestine. The large intestine has got two distinct portions. The first portion, which is called as the colon, and the second portion, which is referred to as the rectum. Now, in the case of the colon, the function of the colon is mainly absorption of water. The colon has got three distinct portions, mainly the ascending colon, the transverse colon, and the descending colon. This eventually merges to become what is called as the sigmoid colon, and then it goes on to become the rectum. The rectum is the portion of the large intestine which is responsible for the storage of fecal matter. Now, when we talk about colorectal cancer, we are talking about cancer which can affect any portion of the large intestine, right from the cecum all the way down to the rectum. This takes us to the question of what are the causative agents for colorectal cancer. Much of our knowledge about colorectal cancer has been derived from the studies of various scientists who worked hard during the early 1950s and proved that colorectal cancer usually arises from an orderly sequence of what actually is an innocuous or an innocent looking polyp, and then actually progresses on serially to become malignancy. In fact, our current understanding of colorectal cancer is that it is mostly a genetically determined disease, which means that colorectal cancer usually arises as a result of certain genetic mutations which predisposes one to develop a colorectal malignancy. Once the patient has got certain mutations, a polyp which was otherwise very innocuous looking undergoes a series of transformations, right from metaplasia to dysplasia, which can be low grade, intermediate grade dysplasia to high grade dysplasia, and then it goes on to become a carcinoma in situ, or that means which is a carcinoma which is confined within the mucosa and which has not breached the basement membrane, and then it actually breaches the basement membrane and then becomes a invasive malignancy. Apart from the genetic factors, there is a certain degree of role of diet as well in the pathogenesis of this cancer. It has been presumed that a diet which is rich in fats, as well as a diet which is composed predominantly of red meat, is also known to predispose the patient to colorectal malignancy. In addition, there are certain other conditions which predispose a patient to a higher incidence of colorectal cancer. Now, what are these conditions? These conditions are those which you would have heard of at some point of time of having one of your near and dear ones or relatives afflicted with it. They include what comes under the umbrella term of what is called as an inflammatory bowel disease, which includes ulcerative colitis, Crohn's disease, especially affecting the large intestine, and what is called as an indeterminate colitis. 2, patients who are known to have multiple polyps throughout the large intestine, as it commonly occurs in the case of conditions like familial adenomatous polyposis coli, or in the case of Lynch syndrome, also referred to as a hereditary non-polyposis colorectal cancer. All of them are highly at risk of developing colorectal cancer. In addition to that, obesity, as well as a lack of exercise or a more sedentary lifestyle as opposed to a more active lifestyle, are also known to predispose to this malignancy. So much so that the incidence of colorectal cancer as well as other malignancies, including cancer of the uterus or the cervix or even the fallopian tubes in the ovaries, are all high in patients who are having obesity, which actually leads to a term which is called as a corpus cancer syndrome, which means patients who are obese are at risk for all these malignancies. So what actually protects us from developing colorectal malignancy? The first one and foremost is that our body's immune system is endowed with the ability to prevent colorectal malignancy. In addition to that, any person who leads a very active lifestyle and who is not obese and who is very athletic has got a lower risk of developing colorectal cancer than a patient who is very obese. In addition to that, a person who takes a diet which is rich in antioxidants, the commonly known antioxidants are vitamin A, vitamin C, vitamin E, selenium. Any diet which is rich in all these antioxidants, or even for that matter, some say that if you take a diet which is rich in fish, is also known to protect a person from developing colorectal malignancy. Having said that, let us see as to what are the symptoms that a patient with colorectal malignancy usually manifests with. In fact, many of the patients, if not most of the patients, are usually having only mild symptoms or are generally asymptomatic by the time the cancer reaches an advanced stage. This is because these malignancies may produce subtle alteration in your daily habits, which will not actually raise any alarm bells or ring any alarm bells in your mind. Now, what are the sort of symptoms which we are talking about? It might be very subtle, like for example, it might be an alteration in the bowel habits. A person who has been used to passing stools once a day might find that he's made to go to the toilet around 2 or 3 times a day, and each time he might not have the satisfaction of having emptied his bowels properly. In addition to that, sometimes they may manifest with symptoms of weakness, loss of appetite, and even weight loss. There could be a history of symptoms like bleeding per rectum, that means a bleeding which is noted at the time of defecation, which could actually raise an alarm bell and may prompt a visit to the clinician. Once the patient has these sort of symptoms, which I have mentioned right now, he should not hesitate to take the opinion of an experienced gastroenterologist to see as to what further needs to be done. Sometimes the patients may present at a very late stage of the malignancy when the tumor actually attains a very huge stage or huge size. On examination, the clinician might be able to see that the patient is having a very low hemoglobin as manifested by pallor. Sometimes he could be eliciting certain signs like a mass in the abdomen, and there could be enlarged lymph nodes. Once a patient seeks the help of a clinician, the clinician usually takes the help of certain tools to establish a diagnosis. So how does one establish a diagnosis of colorectal cancer? The gold standard for diagnosis of colorectal cancer is by means of getting a colonoscopy done, which means a full colonoscopy right all the way from the anus till the ileocecal valve, and obtaining a biopsy which conclusively proves that the patient has got a malignancy. In addition to that, one can also request certain tests which will help to determine whether the patient has got a low hemoglobin as a result of the blood loss, certain tumor markers like for example the carcinoembryonic antigen, which has got more of prognostic rather than diagnostic value, and certain other tests like for example which are like a CT scan, which will help us to assess the stage of the disease. Once the diagnosis is established by means of a biopsy, the next step is to assess the stage of the disease. In fact, the tests which are commonly used to assess or make a diagnosis of the stage of the disease are usually the CT scan or an MRI with contrast, which enables us to find as to which all parts of the abdomen as well as the chest are usually affected by the malignancy. Colorectal cancer is known to spread to the regional lymph nodes, it can spread to the liver, it can even spread to the lungs and other parts of the body. Another useful diagnostic modality for staging the disease is an endoscopic ultrasound. This diagnostic modality employs the use of an ultrasound at the tip of an endoscope and helps to assess the local extent of the lesion. So a combination of a CT scan or an MRI with an endoscopic ultrasound and a PET CT scan will help us to accurately stage the disease. Once the disease is accurately staged, then comes the question of treatment. To say in short or in brief, the treatment basically or essentially consists of a combination of surgery, chemotherapy, and in selected cases radiotherapy as well. Now, surgery is usually widely employed and is probably the most commonly employed tool for treatment of colorectal cancer. For stages 1, 2, and even certain cases of stage 3, surgery is often the first modality which is employed. Once the specimen is resected and has been sent for histopathological analysis and the results are obtained, that will give the clinician as to much better information regarding the stage of the disease, the extent of the disease in terms of involvement of the mesorectal fascia, in terms of the lymph nodes involved, whether there has been any perineural or lymphovascular invasion, and will help the clinician to take a decision or take a call on whether adjuvant chemotherapy is required or not. Chemotherapy is usually employed in situations where it's a T4 lesion, that means it has already reached the serosa of the large intestine or in the rectum, or in cases where the disease has already spread to the lymph nodes. Apart from chemotherapy, radiotherapy is also used in selected cases in order to reduce the risk of late or local recurrence of the disease. So, as you would understand from this presentation, not all is lost for patients with colorectal cancer. In fact, colorectal cancer still remains one of those malignancies where patients can hope for a 40% 5-year survival despite being diagnosed with a stage 3 disease. So, my suggestion and my request to all of you would be not to ignore your symptoms and get yourself checked up with the gastroenterologist at the earliest if you have any of those symptoms or alarming signs which I had mentioned earlier during the course of this presentation. Thank you very much on behalf of me as well as my entire team from Naseem Rabeeh Medical